We welcome everyone to today's hearing on the dangers and due process violations of gender-affirming care for children. Jennifer Bauwens is serving as the director of the Center for Family Studies at the Family Research Council. Her research focuses on identifying and advancing policies that will best serve the health and well-being of families and communities. And Dr. Bauwens, last but not least, you may begin.
Chairman Johnson, Ranking Member Scanlon, and members of the subcommittee, thank you for the opportunity to speak with you today. My name is Dr. Jennifer Bauwens, and I'm a licensed therapist, clinical researcher, currently serving as the director of the Center for Family Studies at Family Research Council. Based on over 25 years of experience as a clinician providing trauma therapy to children, and as a researcher investigating the psychological effects of traumatic stress, I'm here to express my concern about what has been termed gender-affirming care. I've considered it a privilege to practice, research, and train future clinicians and be a part of a discipline aimed at protecting and bringing healing to the most vulnerable in our society, which are children. But when it comes to gender transition procedures, my field is not operating as a helping profession. Instead, it is actively causing harm. Historically, children have been treated as a special and vulnerable class in the psychological and research fields. Caution has been applied to children in light of the fact that they do not have the neurological capacity to understand lifelong decisions. Professional and research ethics tell us that we should proceed very cautiously with regard to interventions for children when empirical evidence is weak or the research methods are in the early phase, as with this case. We should avoid interventions that pose unnecessary risks, particularly when the symptoms are known to change with maturation. But risk avoidance is not what's happening with gender transition procedures. Instead, we have too many cases like Mike. Mike was 9 years old when he first saw a gender therapist. I was deeply saddened when I read his gender therapist case notes, where it was reported that Mike couldn't distinguish between fantasy and reality. Instead of investigating these symptoms, the therapist wrote in the treatment plan, which included puberty blockers, guidance on social transition, and education for future hormonal and surgical procedures. This treatment plan was enacted without regard for this child's known diagnoses of autism, possible OCD, and possible parental diagnoses, which were reported in the case notes. Mike is just one example of how so-called gender-affirming care is in direct opposition of our knowledge regarding development and our understanding of good research and treatment. And there are many reasons why I have concerns, but I'll just share a few with you. One, these interventions are being endorsed based on consensus, not evidence. In the case of gender-affirming care, the term evidence-based does not mean that this practice is standing on the merits of solid research findings addressing gender dysphoria. Instead, it refers to a vote by those who are ideological supporters of the practice. Compared to other psychological disorders found in the DSM-5 TR, gender dysphoria is currently being treated with the most invasive interventions connected to a psychological issue with the lowest quality of evidence to support that practice. And two, the success rates of non-intervention for gender dysphoria for children already exceed what most psychological interventions have. In most cases, 85% or more of those experiencing gender dysphoria will desist if they are left alone. This is a higher rate than most well-established and researched psychological interventions, and with success rates this high, it is actually unethical to intervene. Three, the research and practice around this issue does not properly account for competing diagnoses and variables. So in one example, a report from the UCLA Williams Institute found that 45% of transgender identifying people reported childhood sexual abuse. As a trauma clinician, I can tell you that when someone experiences sexual trauma, it is not uncommon for that person to hate parts of their body or want to get rid of those aspects of themselves that made them vulnerable to abuse. And four, it is often claimed that a failure to provide these interventions increases the risk for suicide. This approach is actually unethical, and it's a clear departure from the practice of empowerment and self-management, which are important goals of mental health practice. This claim is also not supported by the literature. Despite years of empirical study, there is no definitive understanding of the etiology in the suicide literature. 5, after a review of the literature, other countries have actually backed away from gender transition procedures, and the list now includes the United Kingdom, France, Finland, Norway, Australia, and Sweden. And 6, last, gender-affirming care has created a monopoly on treatment options, as it demands that it is the only way to treat gender dysphoria. By comparison, we can look at Cochrane collaboration, for example. There are 245 meta-analytic reviews of varied treatment options for depression. Yet when it comes to gender dysphoria, there's only one path currently prescribed to help someone, and that's to become someone else. Researchers and clinicians should be innovating solutions to heal distress, not coercing kids onto a path that tells them that they need to remove or change physical parts of who they are in order to be whole. This is why I'm calling on you to act on behalf of children. Thank you.
Thank you. Sorry for that buzzer background noise. Didn't rattle you at all. We will now proceed on to the 5-minute rule with questions, and the chair recognizes first the gentlewoman from Wyoming for 5 minutes.
First of all, I want to say thank you for being here. You are 4 incredibly brave women, and you're my heroes. You have been willing to put yourselves out there to address something that many people want you to stop talking. They want to prevent you from talking. Don't listen to them. Make sure that you continue to use your voice to educate us, to educate the American people, because these children are worth saving. Dr. Bauwens, I want to thank you for being here. And in your testimony, you referenced what I think is one of the more important points in this debate, and that children are treated as special and a vulnerable class in the psychological and research fields. You referenced the experience at Tuskegee, and to me, the important takeaway here is that controversial so-called healthcare practices, treatments, and experience have not always withstood the test of time. Outside of your reference, I think of how lobotomy was once a form of care we wouldn't even consider today, and in fact has been banned in countries throughout the world. In this debate, I have wanted to replace the misleading terminology gender-affirming care, especially as it relates to children, because 1, it replaces the biological reality of sex, and 2, because it falsely suggests that using the term affirming that there is anything good going on here. There are only 2 sexes, boys are girls, and girls are girls, and one cannot become the other. In fact, and especially when it comes to children, it seems to me that gender-affirming care is better described as sexual lobotomy. It is treatment that is fundamentally and permanently alters the sexuality and medical and psychological well-being of these patients. It causes irreversible sterilization and serious long-term medical complications and long-term reliance on pharmaceuticals. These treatments and surgeries are controversial medical practices that seek to change a person in a manner which is not actually achievable, and they will not withstand the test of time. Dr. Bauwens, are there medical professionals in the U.S. and abroad already rejecting these surgeries as any form of serious medical care?
Yes, thank you for your question. And we are seeing an increase of medical professionals speaking out. Just this past week, there were 21 doctors that came out and said, we are very concerned about this. The own AAP, American Academy of Pediatrics, was referenced earlier, and 80% of their membership has been asking for a review of the literature, and they've been denied that review by the upper echelon. So there are, and I listed many other countries, there are people who are standing up because they're seeing the harms done to these kids like Chloe Cole.
Can you discuss why referring to these treatments as life-saving treatment is so extremely misleading?
Yeah, it's misleading for a number of reasons, because for one, the whole impetus of the scientific method is that we're discovering things. We're supposed to be in a process of, is this the right approach or not? And this whole discussion about saying that it's life-saving automatically says there's no room for discussion, there's no room for scientific inquiry, because the science is settled, which is, it's an amazing statement, because the suicide literature has been around far longer than the transgender literature, and the suicide literature is not conclusive. So we have a real, right hand doesn't know what the left hand's doing in this case.
It seems to me what we've been living through for the last couple of years is a government that wants to suppress any type of speech that it disagrees with. And we're seeing that with the industrial censorship complex that we've been talking about. And it appears that that's exactly what's going on here. They want to stop the debate because they know that they can't win it. Dr. Bauwens, my last question is what is the success rate of sex change operations?
Well, we have, it's hard to find longer-term data with children, but what the data that we do have, which is probably the most reliable data point available, is from a Swedish study, and it looked at over 10 years, which is really important because regret doesn't just happen a year after some sort of transition. And what you see is a suicide rate that's associated with 19 times higher than the general population.
Well, actually, there is a 0%, there's a 100% failure rate for sex change operations, isn't there? Because it's not possible to change your sex.
That's right.
100% failure rate for these procedures.
That's right. You can't change your sex.
Thank you, and I yield back.